I'm about to instruct a new physician provider in the use of the an electronic medical record, or EMR. Okay. All right. Go ahead and first thing you'll do is click on the patient's name.
Okay.
Okay. And then from there, you're going to find your note. Click on Provider Note. Okay. And click on My Note. Okay. That's the note you're going to put in. Okay. From there, you're going to start with your history of present illness, or HPI.
Okay.
Okay. You can add your complaint. Type your complaint in.
Okay.
From there, now it's just a matter of pointing and clicking what happens to pertain as far as your HPI goes.
Okay, so it's a patient with a cough for 2 days.
Right. You have your frequency, progression, cough characteristics, and fever.
Okay. What's been tried, I guess?
Yes, ma'am. Okay. Excuse me.
Okay, now I'm done with that. So
Okay. Next, you'll go up to your left, click on your Review Symptoms, or ROS.
Okay.
All right.
Click the negatives.
If they apply, yes, ma'am. If they're negative, you can just go ahead and click on them instead of individual pointing and clicking.
Okay.
Okay.
And then what are these white for?
That's if you want to add a mini note.
Okay, so I click on.
Click on the right.
And then these are.
That can create a phrase within your note.
Okay,
yes,
so there's some already made that you told me about.
Right.
And then these little things that you said to hit.
F8.
And I can just modify the note.
That's correct. Delete what you don't want, add what you do. Okay.
Okay, and then
Okay. Hit accept once you're done.
Okay, so that's done.
So that's done. You go to your PE, your physical exam. Okay. Roughly doing the same thing that you did previously.
Just pointing and clicking.
Pointing and clicking to the different body systems as they apply.
Okay.
And
you said this earlier.
Okay.
It's a normal exam.
Normal exam. Click on that button and bring that up for you. Okay.
Okay. And then I can go back to the navigator.
To view the note. That's been done thus far. Yes, ma'am. Click on orders that need to be done. Correct. Good.
Can I write in my prescriptions here?
Yes, you can. Med orders. Yes, ma'am.
And this picks up most of the prescriptions. They're already preloaded.
Pre-populated. Yes, ma'am.
And it prints it for me automatically?
Yes, it will.
So any prescription that I want is automatically put in there?
Yes, ma'am.
And then I just sign them here?
Sign, right, correct.
And put my name in?
Okay, so we're in position. Accept that.
And my
Password. Of course, this is your follow-up. You're in your disposition now. Okay. Any follow-up procedures for your patient are going to be done here.
Okay.
Okay.
So I've already. And this is impression, or what I put in.
Clinical impression or diagnosis, more than one.
You can put as many as you want.
Right. Yes, you
Good.
can. Disposition for typically discharge instructions.
Okay. And you said there was a smart phrase, and these are already set up so that I don't have to redo them.
Redo them again, correct. Okay. This is your level of service for your visit codes. There you go.
Okay. And so
Close that once you're done.
I can go back here
To note writer.
and I can put all that information there.
Yes, you can.
Highlight.
Highlight whatever you want to add. You can copy and paste that instead of writing it all in.
So I can just take the ones that I want because I don't want all
Right.
those, right?
Correct.
And so copy and paste.
Correct.
So right click and left click. Or
Right. And then, yeah, left click to the note. There you go. Paste it in.
Okay. And then you
Good.
mentioned there was another smart phrase for the diagnosis.
By typing in, right, period DIAGX will bring up the
So that's neat. You know, everything's there for you.
pre-populated, yes ma'am.
Okay. And then once I'm done with the note,
Click,
just sign it.
you can sign it once you can view it. You can go to pending and view it. If it's ready to sign, you can just click sign, yes ma'am.
Okay. And then everything should be done for that chart.
Correct, for that particular patient. Yes ma'am.
Okay. So everything seems to be, it takes a lot less time this way.
Correct.
So there's my note and all my stuff.
Can view it.
Okay. And it should be this simple as...
For every patient, written up, basically in the same format, yes ma'am.
You can get rid of any medicines that I don't want by discharging those.
Correct.
All right, well thank you so much.
No problem. Good job. Again, same procedure for any other patient.
And they should
Okay.
discharge after
Discharge
it's
once the
done.
note is signed, yes ma'am.
Okay, great.
Yes ma'am.
All right, well thank you.
Well, thank you very much. Good job.